Well, good morning, good afternoon, depending on where you folks are at. This is Nick Randall with Western Marketing. Want to thank everybody for taking time out of their schedule to hop on the call. Sorry, we are just a couple minutes late. We had a little bit of technical difficulties here in getting things started, but we should be good now. Today, we are fortunate enough to have Michael Torrenti with Rural Neighbors on the line. He has been with us for a number of years. He's our regional that we deal with, and Rural Neighbors. If you don't know their story, they are a great fraternal organization. We've been partnered with them for years and years. I don't even know how long, probably over 20 years, I think, ultimately. But they do a fantastic job with the products that they write and have a very simple process in some of their different ways as well. So Michael will go over that in more detail. But I just wanted to, give that preface here. A couple quick housekeeping items before we get things started. This is being recorded. So if you do have to jump off early or coming in late, not a problem at all. Anybody who registered for this webinar will actually get the full recorded version of this. And then I will also be sending out additional information on Rural Neighbors in that email as well. So with that, also, if you have questions in GoToWebinar, just type those questions out. We will address those at the end. And that takes care of any housekeeping items I have to address here, but I'll hand things over to Michael to get things started.
Great, thanks, Nick. Thank you all for joining us today. Very excited to again partnering with Western Marketing, and great organization, great relationship that we've had over many years, as Nick said. And it is about you as the agent that really keeps us going here at Royal Neighbors. So we're going to talk about insurance with the difference today, and what that means to us and our products, our portfolio, and the different ways that you can use the application process, whether it be in person or via remote as well. So Royal Neighbors, founded in 1895 in Council Bluffs, Iowa, currently headquartered in Rock Island, Illinois, founded by 9 visionary women. So if you think back in 1895, what life was like for those 9 women at that time, very few educational opportunities, you couldn't vote, you couldn't own property, and very few really life insurance opportunities. So they got together and formed the foundation to what we know as Royal Neighbors today. So again, insurance with the difference. For us, the focus has always been around protecting women financially and those that they love. We are a fraternal benefit society, as Nick said. So a lot of it for us is giving back in our local communities. It's our social good, what we do in those communities, and the opportunities that we have for our members as well. Great news, at the end of last year, we found out that we were actually upgraded to A Excellent, which is the 3rd highest out of the 13 ratings that AM Best does offer. So for us during the pandemic, it was really a challenge to keep our responsible growth going and manage everything in times of need, in times of a pandemic. And AM Best came through and saw what we had done and upgraded us. So I don't know a lot of carriers out there in the marketplace that were actually upgraded during a pandemic, but it goes back to our financial strength, financially strong, financially stable, and again, upgraded to A, which is great. So again, being a fraternal benefit society, it is given back to our local communities. We had over $17 million in social good impact. That's a combination of the financial grant programs that we run, the money that's donated by our members to our local chapters, the good that is being done in the local communities, almost 260,000 volunteer hours in the local communities. Our Nation and Neighbors grant program awarded again $100,000 last year for women empowerment grants. So those women that are making a difference in their local community, whether they're running a homeless shelter, they're building bags for cancer survivors, whatever it is about giving back to our local community. For us here in Mesa, one of the biggest things that we do as a chapter is every year, the big football game at the end of the season historically has been the Patriots and somebody else, but we put together our Super Bowl, SOUPER Bowl, for canned good and soup collection to go to our local food pantry. So we do know that we are making an impact in our local community at that grassroots level. Our member savings. You as an agent, after you write your first piece of business, you become a member as well. Every client that you have becomes a member. So our member savings, over $1.4 million saved. Again, this is great. You can have the valuable financial protection that you need. And then in addition to, we have our legal services, which does include a free simple will with annual updates. We have prescription drug discounts, vision. I know I can get 20% off of my eyewear at my optometrist, dental, retail savings. There's a ton of different savings out available through our members savings. If you're not familiar with it, I highly suggest looking at royalneighbors.org, our public website, and taking a look at the different member savings that are posted out there. Our newest member savings plan is a telehealth. So obviously during a pandemic, a lot of providers are not seeing patients face to face. It is the way it is now. Telehealth is available 24/7, $38 a visit. You tell a doc right there, you're going to be able to treat, the doctors be able to look at and treat ailments such as cold, sinus infections, allergies. A lot can be done via telemedicine. So this is available to your clients. This is available to you as an agent as well. Again, only $38 per visit. And that's been a widely popular, very popular since its introduction for us. The telehealth through my member savings is actually cheaper than the telehealth for my health insurance. So take a look at that too as well. If you're doing telehealth visits with your physician, what are you paying through your insurance? And then take a look at what you can pay through the member savings. So getting into the product portfolio, for us, it is very simplistic. We want easy to understand and easy to acquire products. So our whole life portfolio does consist of our Jet Whole Life, Simplified Issue, and Graded Death Benefit. And we'll talk about Graded Death Benefit a little bit and where that is currently available and where it is not available. Our Single Premium Whole Life, and then our Jet Term. So some of these products are only available through an EApp platform. Those would be the Jet Term and the Jet Whole Life. Our Simplified Issue Whole Life, multiple ways to acquire. So after you're logging into your agent portal, you're going to see everything right there. We have the button on the left-hand side for application submission tools. We also have one for products, so you can get further information about the products. So accessing the EApps, when we're looking at the EApp process, that's going to take you directly in. Now, all EApps have to be done face-to-face with the client. We do not allow a Zoom meeting. We do not allow any other method except for face-to-face with the client, because they are actually going to sign either the tablet or type their name in into the EApp in order to complete the signing process. So again, must be done face-to-face for the Jet Term, the Jet Whole Life, and the Final Expense EApp, face-to-face only. So when we take a look at our underwriting and the highlights for the Jet Term and the Jet Whole Life. Now both products are fully convertible. Now we're going to talk about the conversion here in a bit. With the term, we'll start with the term. 15, 20, and 30-year plans are available. We do go up to age 65 on the 15-year plan, age 60 on the 20, and then we go to 50 on the 30-year plan. $50,000 minimum available for the term product. Again, accelerated underwriting, we'll take a look at that in a moment. We do not require, with the accelerated underwriting, a paramed exam. So in most cases, you're going to get an instant decision right there with your client. Now the whole life plan as well, 0 to 80 for the lifetime level pay, and the 20 pay is available from just 0 to 65. For the adults, the minimum on the product is $25,000, and for the youth plan, we go from $10,000 to $49,999. Now, again, it does say it's convertible to term. And you're saying, well, why would I have a permanent plan that's convertible to term? Well, if we take a look at the pandemic and the number of jobs that were lost, what's one of the first things to go when your client loses their job? Insurance. If I've got a plan available, now the minimum on the whole life has to be 50,000 in order to convert back to term. I can convert that plan to term. They would still have the $50,000 of coverage at a lower premium amount. Okay, it's guaranteed conversion privilege with those plans. Now let's take a look at the accelerated underwriting. Now the accelerated underwriting, again, no paramed exam required. This is a true point of sale process. The underwriters are not going to touch this app. Everything's done electronically. So in the background, we're ordering the MIB, the RX, MBR. Everything is done right there in the background. So you don't have that underwriting or underwriter viewing this application. The medical questions are reflexive. So if there is a yes answer to a question, it is not an automatic decline. Obviously, it's going to depend on the situation. Heart attack, stroke, cancer, those are going to result in a decline. But if you have a client that has diabetes, for example, diabetes is going to drill it down, ask what the age of onset was, what the current medications, because we're running that RX, and what their current control level is. All that information is put in, and the medical decision is being able to be made right there at the point of sale. So we go up to 500,000 ages 0 to 50 for accelerated underwriting. Okay, with the kids, obviously it's $49.99, but everybody else 25,000 on up to 500,000 up to age 50. From 51 to 60, we go up to 250,000. No paramed exam. 61 and up, we do require a full medical. We will have a paramed exam required at those ages. So in most cases, those age and face amounts, you're going to have that instant decision right there. Now, taking a quick look at our single premium whole life plan, this is a paper application only with this product. The minimum premium amount we actually lowered from 10,000 down to 5,000. Issue ages on this plan do go from 45 to 80. The great thing about this is everything's done on the net amount at risk. Okay, so the difference between what the premium paid is and what the face amount is the net amount at risk. Okay, if there's a net amount at risk under 15,000, then we're not even going to order an APS on this case. Doesn't matter the age of the client. Okay, again, fully underwritten, paper application. This product is great for wealth transfer. You've got the advantage of using the wealth transfer, whether it's coming from a CD, cash value life insurance, a 1035 exchange, anything that you do have a cash value from, money market, you can use that through the wealth transfer into the single premium whole life. Now, looking at the changes to the simplified, again, simplified 50 to 80. This product is a simple yes/no application. Due to COVID, we actually raised the minimum amount on the minimum and the maximum face amounts. So our minimum amount for the simplified issue whole life is 7,000. Our maximum that we'll accept is 30,000. Still a simple yes/no application. There is no height weight chart for this product. So you all have clients that you work, the Bobs that you've worked with in the past, the big old boys, where you've had a tough time placing them. The Bobs are going to be height weight. Don't have to worry about it. Okay. Simple yes/no application on those medical questions. 2 through 7 are knockout. 8 and 9, where the graded product is available, we'll accept for the graded plan. Now, with the graded, the changes for the product, graded has been suspended in all states with the exception of Florida, Connecticut, and North Dakota. Okay, based upon the simplified issue, so the changes with the simplified. So if it's 2 through 7, there are no answers. You're still good. Florida, Connecticut, North Dakota, you still have the graded plan available. All other states, they cannot answer yes to 8 or 9, or it will be a decline. Okay. The portal does have a copy of the COVID questionnaire. It's a 4-question questionnaire for COVID that must be completed at the point of sale as well. That questionnaire, if they have been exposed to COVID or they do have tested positive for COVID, there's going to be a delay. That case will be postponed. We will not issue that case, but that questionnaire is built into the EApp process. That questionnaire is built into the phone process. So with the Simplified, you've got 3 different ways to take that application. 1, if you're face-to-face, you have that EApp available. 2, you can complete a phone interview with the client. You do not have to be face-to-face. If you complete the EApp, there is no phone interview. And then 3, we do still have the traditional paper application that can be completed. If that paper app is taken, you submit the paper app into us, and then we'll contact the client and complete the phone interview. Obviously, if you're meeting face-to-face, the easiest way for that instant decision is going to be that EApp, and it's less time with the client because you don't have to complete the phone application process. Now looking with the authorization on the final expense EApp, again, we're going to ask for the information up front, letting them know that they must be face-to-face. They're going to consent to the authorization, that we're going to order everything in the background. Again, you have to be present in order to conduct an EApp. Payment info. On the payment info tab, this is a great feature. So your client is going to have their choice as applied for. So it's going to come back. This is a 69-year-old simplified issue whole life $10,000 face female. Came back at 53.41. It's going to round up to the nearest $5 and then the nearest $10 amount. So it's going to present a choice at $55 will increase the face amount to $10,312, and at $60, $10,297. They do not have to elect any one of those. They can stick with as applied for, but it does also give them a couple different options right there on the screen. Social Security billing. We have true Social Security billing on the Simplified Issue Whole Life Plan. If your client is receiving Social Security on the 1st or the 3rd or the 2nd, 3rd, or 4th Wednesday of the month, you can set it up. We will draft the same day that the payment is deposited into their account. Okay, you can have that set up to do true Social Security billing. So if your client does answer yes, they do have the Social Security check coming in and that's automatically deposited and they want to have it drafted the same day, we can definitely do that. This is definitely a benefit for you as an agent, as it's more persistent because the business is going to stick because we're drafting the same day. We don't have to worry about sending it out today and having it actually pull 3 days from now. So again, the EAPs our enhancements were made to at the end of the year. We added in that the payer can be different than the insured and the owner. It used to be on the EAP that they had to be the same person. We've also built in replacement forms into the EAP, and we have a save age feature. All of our products are actual age. So if you met with your client and their birthday was on the 1st of May, and they're 83 now, you can actually save age right there on the screen at the 82. Okay, that will present itself as it comes up, but the application date and when your first draft date is selected, that save age button is right there for you, and that will present itself, allowing the client to save age right there. So quoting tools, our agent access is available through either the Google Play Store or through your iTunes Store. You can actually download the mobile calculator right there on your phone. This is great because not only does it have the rates for the whole life and the term, the single premium and the final expense, but you also have the ability to check any pending business. So for whatever reason, if you did take a paper application, that gets scanned into our system. The requirements are going to show out on your pending business. The calculator, it's quick, it's easy, it's available. You click on the calculator button. You're going to go out and you're going to enter basic information. You're going to enter the age, the gender, the state, and it'll display what products are available based upon that criteria to you right there on the screen. After that, you can select the product, go ahead and put the face amount, and it'll display the premium amount right there for you. So Agent Access is definitely a great tool to use. You can also use rnaquickquote.org, or you can pull the rates through your agent web portal as well. Again, that new business feature is available as well. Any pending cases will be out there. Any cases that have been completed in the past 10 days will also show up in your new business tab on your agent portal or on your mobile app. So I know we've covered a lot in a short period of time. You do have your sales support team available to you. They're available Monday through Friday, 8 to 5 Central Time. So anything that does come up with a product question, if you need assistance ordering supplies, you're running your quotes or illustrations, or anything, you need further information on products, your sales support team's here. I always encourage you, if you've got a condition with the client or a med that the client may be on that you're unaware of, give us a call and run it by a risk assessment. Underwriters are available. Hey, I've got a client who, and you can give the condition to the underwriter. They'll take a look at it and let you know right there up front whether or not we're going to accept it, if it's going to be rated, or if it'll be a decline. Same toll-free number. Option 1 will get you into the agent line. Option 1 will get you into new business, or option 5 will get you into sales support. Our trip this year, we're going to Banff, $80,000 or 80,000 production credits for agents. This will be at the Fairmont Banff, Alberta, Canada, June 5th through the 8th, 2022. So we still have time. You've got 7 months of production to go in order to be on pace and to qualify for Banff. This is going to be a phenomenal trip. We're definitely looking forward to it. With the COVID going the past couple years, unfortunately, we've had to cancel our last 2 trips, but we're definitely looking forward to going to Banff in 2022. And I'm going to open it up for any questions.
All right. Well, hey, thanks so much, Michael. I definitely appreciate you going through that. Kind of a quick hit of everything that they've got over at Royal Neighbors, obviously from their benefits as a fraternal organization, their products, as easy as they are to do business with, are a huge play in the market. So just as a reminder here on this call, it was recorded, so if you jumped in late and missed the beginning, no worries at all. We'll be sending that recorded version out to you here this afternoon. In addition, I'll be sending out some additional information on Royal Neighbors. If you do want to contract with Royal Neighbors, it is all done through Surance Bay. So if you're in our Surance Bay system, we can get that contract going for you relatively simply. And that kind of wraps things up. So I wanted to keep this kind of short and sweet. And that's kind of about it. So, thanks everybody for taking time out of your schedules here today. And we look forward to, helping you out in any ways we can. If you need quotes on Royal Neighbors or more product-specific information, let us know. Our number here at Western Marketing is 800-852-7152. But with that, I think we're all set. So thanks so much, Michael. Appreciate that great presentation, and everybody have a great rest of your Wednesday.
Thank you.